to was the fact that there was now an all-of-government approach. There was national leadership, there was buy-in and coordination between the national and the sub-national leadership, and there was a coherent strategy. And the fact that that strategy was launched as a single plan, and there's that people are gathering around that as a single strategy. Surveillance has certainly been enhanced in terms of the case detection and the amount of testing, and in order to support that, we're working in conjunction with the Chinese government. China brought in over 20,000 tests. We brought in over 100,000 tests into Iran over nearly 2 weeks ago. The days blend into one another at this point. And equally, both China and ourselves brought in personal protective equipment. We've made it clear that those supplies are very, very short, and we're struggling to find other supplies externally. We do, as I said previously, have thanked the United Arab Emirates for their facilitation of the process, and again, we're working with countries, including China, on resupplying our logistics hub in Dubai. We've sent a further 40,000 tests into Iran over the last 24 hours, again to increase the intensity of testing, and in the end, all of this is drawing millions of dollars of resources in order to continue to supply that. Right now in Iran, there is a shortage of ventilators, there's a shortage of oxygen, and clearly, and you've seen this in Italy and you've seen this in other countries, what happens at this stage in an epidemic that's intense, that's generating a lot of severe cases. As of this morning in Italy, there were nearly 900 people in intensive care. That requires a huge health worker commitment. To take care of intensive, really unwell people can often require 2 to 3 medical staff at one time, all in protective gear for hours and hours. Number one, they use up a lot of protective gear. Number two, they become exhausted very quickly. And our concern for our colleagues in Iran and in Italy right now is actually the caseload, the demand on the health workers, and the dangers that come with fatigue and potentially shortages of PPE. So we all must move quickly. While some countries are affected more than others, and yes, we can get into the game of whether governments are doing enough or not enough, or whether things were better planned or should be planned. The fact is, right now, in countries, we have frontline health workers who need our help. We have hospitals who need our support. We have people who need our care, and we need to focus on getting our frontline health workers the equipment, supplies, and training they need to do a good job. So I think we need to, in that sense now, all focus on the job at hand. We can work out after the fact, could we have done it better, or who's at fault or who's to blame. We really need to focus on the word that the Director General has been using for weeks: solidarity, getting the job done. We need to move now. Iran and Italy are in the front line now. They're suffering, but I guarantee you other countries will be in that situation very soon. So we all need to show that solidarity for each other. We're focused on practical support to Iran, and we will continue to provide that, and working with international partners.
Thank you. Just 2 lines I would like to add. From the reports we got from our experts who are on the ground, we know that Iran is doing its best, all it can. That's number one. And that's what I appreciated. And second, they need lots of supplies. And as Mike said, we have tried to support as much as we can, but there is still a shortage. And we're trying to mobilize more support for Iran. Thank you.
Thank you very much. We'll try to take a few questions from journalists online, and I will remind how you can ask question. It's *9 for those online and those dialing in, and it's a clicking raising hand. So let's start with Helen Brownsfeld. Helen, can you hear us?
I can. Thank you very much for taking my question. I'm wondering, you are getting additional information from China. In particular, I'm interested in finding out if you've had any word about the serology study that they were meant to be doing. I would have thought that they would have had data by now.
Thank Thanks, Helen, for that question.
One of the things that we are hoping for in the coming weeks are results from serologic surveys. So as you all know, molecular tests were developed very quickly, serologic assays are being developed very quickly, and they're in use in a number of countries. We understand that there are serosurveys that have begun in several countries, including in China. We do not yet have the results from those, but what we're hoping for, what the results we are expecting in the coming weeks will have to do with better understanding the extent of infection in the general population, hopefully by age structure. We've seen the protocol that will be used there, and it is an age-stratified general population serosurvey. So it will take some time. We do need to give them the time to run these epi investigations, these sero-epi investigations. We are pressuring them, and not only China, all countries to carry out these types of investigations, share their results with us so that we could better understand how transmission is occurring. But it will take some time.
Thank you very much. Let's try Isabel from FA.
Spanish News Agency. Isabel, can you hear us?
Hello, yes. Do you hear me?
Yes, please go ahead.
Yes, thank you. It's regarding the rapid increase of cases in Spain in the last 48 hours, and I would like to know if you consider that the measures imposed by the government are enough, or it needs to be more aggressive at this stage to contain the spread of the virus.
I think all countries now need to take a very close look at what are their objectives in responding to the epidemic in their own country. Are they accepting that the disease can now spread completely in an uncontrolled fashion to all corners of their country, and they're going to focus on just trying to keep the health system moving forward and trying to keep the health system from collapsing? That's what's known as mitigation, and the focus is on effectively supporting the health system to reduce fatality. We've had lots of people talking about containment versus mitigation. The Director General has spoken since the very beginning of this outbreak about a comprehensive approach to this epidemic, focused on containment where there's an opportunity to contain, containment on isolating the virus within the chains of transmission that exist, and preparing the health system to reduce the impact should the disease escape that control or escape that containment. And that is what's known as mitigation. It's very important that people, I think, understand that the DG statement today is not an escape clause to mitigation. It's not about saying, okay, now we have a description of pandemic, we all move to mitigation. Nothing could be further from the truth. It is not the time for countries to move towards mitigation only, unless and until they are not in a position to affect the course of the epidemic and try and stop this organism. The difficulty is that if you do not try and suppress this virus, it can overwhelm your health system. So there have to be very strong efforts made to suppress infection, to push the infection back, because at the very least it will take the pressure, it will allow and flatten the curve and allow your health system to remain in control and achieve some success in reducing case fatality. So from that perspective, I think it's very important that we use our words very carefully from here on in. With regard to Spain, Spain has a number of cases have accelerated very, very quickly over the last couple of days, as have France, as has Norway, as has Denmark, and as have a number of European countries. So it's very important that countries in the European Union and in Western Europe really do look at what their current control strategy is for this disease, and to assess whether the efforts they're taking are good enough in terms of suppressing transmission and pushing back the virus, and then obviously preparing their health systems to cope with the cases that do occur. All countries need to review their strategies right now.
Yeah, thank you. I would be happy to add to that. I had a very good discussion with His Excellency Prime Minister Pedro Sanchez of Spain 2 days ago, and I was, very much impressed by his commitment. And Spain is using the whole of government and whole of society approach And we believe that that political leadership is really key. And we discussed about that approach, mobilizing the whole society and making the response everybody's responsibility. And we hope to see progress in Spain too. The Prime Minister took the initiative to call WHO and to consult, and that's a very important measure, actually, indicators of leadership. And he told me that he's prepared to do everything to stop this outbreak. Then on containment and mitigation, again, we don't want anyone to make a mistake when we, say the situation now is pandemic. We're not saying that the world should move from containment to mitigation. We are not. We believe as WHO that the comprehensive or blended approach should continue. And in that comprehensive and blended approach, containment should be the major pillar. As Mike said, the numbers themselves actually speak why we're saying this. 81 countries have no cases, so they should do everything to prevent from importing any case. They shouldn't give any ground for this virus to set foot in their country. And then there are 57 countries who have reported less than 10 cases, 10 or less cases. They can cut it from the bud. 81 plus 57 is 138 cases. And 90% of the total number of cases we have, the total 118 cases globally, 4 countries reported 90% of it. 90% of the 118,000. So it will be a mistake to abandon the containment strategy. Of course, the rest of the countries will be between the 4 countries who have reported more than 90% and those who have reported 10 cases or less. So we believe that the best way forward is the blended comprehensive approach, which puts containment as a major pillar. And we have also given examples. Many countries have already shown that when you have cases, still can be contained, however big the number of cases is. And we are convinced that although this is the first coronavirus to be labeled as pandemic proportion, but at the same time, we believe that it will be the first also to be able to be contained or controlled. That's what we are saying. It can be, because we have seen progress in countries that have already shown this. So we repeat again, we're not suggesting to shift from containment to mitigation. We are not. We underline that. We're still proposing containment strategy and other strategies, a comprehensive and blended strategy. But considering the geographic spread and the number of cases that has increased in the past 2 weeks, we should double down and we should be more aggressive. That's what we're saying.
Thank you very much. We will now call on Christophe from Rwanda. Christophe, can you hear us?
Yes, I can hear you. Thank you very much. I hear you well. I have a couple of questions. The first, I want you to give us an overview of the status of preparedness and risk quarantine centers.
Preparedness study in Africa.
What? Can you see? Can you hear me? May I go? May I go ahead? May I go ahead?
Christoph, can you try one more time? You are broken, but please go ahead. We heard that it's something about preparedness, but repeat your question, please.
Okay. I want you to give us an overview of the status of preparedness and response in Africa in terms of surveillance, treatment centers, supportive treatments, availability in Africa. Secondly, there is an unverified information that Black people are resistant to COVID-19, and this is affecting people's willingness to implement preventive measures. What's your comment on this? Thank you.
Thank you, Christoph. I think actually Africa in general has made very rapid progress in its general levels of preparedness over the last 8 weeks. All countries in Africa now have the capacity to make the diagnosis, and some are demonstrating that, unfortunately, through the diagnosis of COVID-19 cases. A lot of syndromic surveillance systems, early warning systems, polio systems in Africa are now being turned towards detecting ARI. The network of 2 reference labs for influenza surveillance and the network of labs for national influenza labs have been working together on detecting, doing systematic testing in samples collected with suspected flu, and they're now testing those samples systematically for COVID-19 across a number of countries in Afro. 41 of 47 countries in the Afro region, the Afro region is essentially sub-Saharan Africa in Africa for WHO, have completed comprehensive national action plans for the control of COVID-19. At the moment, we currently have our staff working today in Washington, completing the mechanisms by which funds will be released into those plans. But in the meantime, as that has been done, we have sent millions of dollars through our WHO system to provide support for training, provision of PPE, further support to the labs, etc., etc. We can provide more of a detailed update from our Africa office on other matters, but there still remain concerns and weaknesses, and the things you mentioned there, like isolation facilities. For example, in Congo today, yesterday we had our first case. We're already redirecting some of our Ebola response capacities towards the potential isolation and treatment of cases. I think in other countries, in Nigeria, for example, within 48 hours of the first case, Nigeria had established a 100-bed isolation unit. So, but I think the development of the clinical support and isolation services is uneven, and while it may be present at national.
All right, we've just lost that link to Geneva. That was the World Health Organization briefing the world, really. Many people listening in as the UN, the World Health Organization, declares the coronavirus a pandemic. So epidemics, regional, pandemics, global. And very interesting what's been said there, that many countries still have an opportunity to contain the virus. Containment is still very crucial.